Well, new today, an advisory from the U.S. Surgeon General that will be of interest to parents.
Yeah, he says social media presents a, quote, profound risk of harm. Here are the main takeaways from the report. Surgeon General Dr. Vivek Murthy says we're in the middle of a mental health crisis when it comes to young people. He's worried social media is contributing to that. Today's recent report says up to 95% of kids between 13 and 17 years old are using social media. That has Dr. Murthy worried about brain development, along with the risk of bullying, depression, and anxiety. He's calling for more research and for immediate action by tech companies and lawmakers. So that's the report, but we want to dig in a little bit deeper into this topic.
So our Derek James hopped on a call with a local psychiatrist that specializes in working with kids.
So Dr. Stein, what were some of the biggest takeaways that you saw from this new advisory from the Surgeon General?
Yeah, so I think many of this and many of these details are thoughts that we had and we assumed, but it provided medical evidence based on numerous trials for some of the challenges we're seeing our children face in relation to social media.
This feels like an opening, as a parent myself, for us to now have that conversation. We can take this news and kind of use it as a jumping off point. What would be the tips you would give for parents to start a discussion about good social media use?
Well, I love that because I think number one is communication. And it's something that people use privately. They hold it in their hand. We can't see over their shoulder what they're doing, but we need to communicate about this. The world is at our children's fingertips in a good way, but also the world can reach them. And so we really need to examine this and start to talk about it now. It's not if there's going to be a dangerous event that happens, it's when. And there's two levels of it. There's a level of acute danger, like somebody reaching out to your child or forcing them to share something they don't want to share. And in my practice, I do sadly see that. There's also the more kind of insidious, slow danger of losing track of friends, losing track of activities, losing track of time, negative effects on sleep and relationships, kind of FOMO, doom scrolling, all these kind of negative at risk patterns and behaviors that can really emerge over time.
Are the kids that you see in your practice, many of them adolescents who typically have more access, they all have phones, are they bringing it up more, and are they bringing up new concerns related to social media?
Yeah, so I think in the last 5 years or so, we've seen more and more kids enter our higher levels of care after an event online where they've been bullied or they've been embarrassed or they've been shamed or feel shame. And that has been kind of a precipitant for a crisis more and more often. We also see kids that have the insight that it's not healthy for them, but on the other hand, don't know how to live without it or exist without social media.
Is some of that, Dr. Stein, because they see their parents on it, maybe just as much or more than them, and that's one of their gaps in communication as a family?
Well, I think we need to remember that we are role models for our children. We're at their events and they look to us while they're doing their gymnastics and we're looking at our phone. They feel like there's the importance. There's where my parents' eyes are. So we need to be really aware of our own practices.
In just a few seconds, if you could tell parents and maybe young people listening right now what they need to think about going forward, what would it be?
Just a few months, but I think number one, there's no room for mistakes when you share things online. They do not disappear and remain present forever. That you will run into weird, uncomfortable themes that are mature, that are beyond you online. The door needs to be open to talk to your parents about that. And if you cannot, digital health is something that your physician, your psychiatrist, your social worker, your pediatrician are ready to talk to you about. And it is part of our exam now to ask about your digital health and what you're seeing. And it's okay to feel uncomfortable and lost, and we're happy to talk through it with you.
That was extremely helpful. I don't know if I've ever heard it put quite that way, but Derek James is back now to talk with us about it. You are the resident parent here on the 4. You're the only one, and so I wonder, having that conversation, if things hit home for you with your kids.
Absolutely. The social media struggle is real, and I hear that from parents I talk to all the time. It's a common thing. This is one of the things you talk about the most, and my kids I only have one who has a phone. He's in 8th grade. The 6th grader has an iPad that he can get online with. They do not have social media accounts. They're not on Facebook or Instagram or TikTok, but they go to YouTube and they watch videos there and the shorts and things like that. My biggest concern at their young age was being able to communicate with other people, being bullied online. So that's why we don't have them on those sites. But we still struggle with the amount of time they use. And my biggest concern is them disengaging. It's the easiest way to go to one of these devices when a situation makes them feel awkward, or they don't want to meet someone new, or they don't want to talk to those relatives we haven't seen in a long time.
I was working on a story for Good Question about loneliness, and I spoke with a child psychologist. And young people can be connected to so many others on social media, but still lonely at the same time when they think about what they don't have because they're seeing what other people have, and then they kind of close in, like you were saying.
Especially this time of year, think about it. The kids are going to be leaving school again, coming back from COVID. They started to maybe get a little less awkward with that face-to-face interaction, but then they're not going to see their friends every day. They're not going to have those interactions with adults, including teachers.
I think about when I was in middle school, how you have, the class about reproductive health. Is this a big enough mental health issue now that we should also be talking about potentially putting this into health classes in school?
I think so.
I think that's fair. It's an evolving curriculum.
Yeah, a big part of the conversation. Thanks, Derek.